So the key issue that we were addressing in that research study was looking at a new way to try to help people with spinal cord injury regain their ability to balance while they're standing so that they can be more functional in their daily lives. Our approach to solving that problem was to use an intervention that's been around for many decades. It's called functional electrical stimulation. It involves delivering a low-level electric current to muscles to help them contract in people who have weakness or paralysis. FES, or functional electrical stimulation, is used for things like to help retrain walking, but it had never been used really to look at retraining balance control. So that was the new approach that we brought in this study.
Our balance training program that we had participants complete involved some visual feedback where we had targets represented on the screen, and the goal was for them to shift their center of pressure, which is a way that we kind of view balance, into these targets, hold that position, and then return to the middle, shift into a new target, hold that position. At the same time, while they were doing this movement, we had electrodes on their lower legs, and these electrodes would then contract the muscles in the system and help guide them towards those targets.
What we found in this study was that people participated in just a small number of sessions of balance training, but after those small number of sessions, they showed pretty significant improvements in their balance control, which we measured objectively.
A lot of the individuals who we had go through this balance training program had all been living with a spinal cord injury for well over a year, some even up to 10 years. And usually at this stage, there's not a lot of improvements that we see. So it was really, really cool for these individuals to actually see that we were still able to make changes, and significant changes that were actually reflected in what they were able to do at home, with their family, with their friends, and just sort of engaging and back in their community.
So things like one gentleman talked about being able to go to his son's house and be out in the backyard safely and participate in a barbecue. Another talked about being able to go golfing for the first time since sustaining their spinal cord injury. And other things are more simple but very important things, like being able to go use a public restroom when you're out somewhere. In our initial study, we looked at feasibility, safety, tolerance, all very important factors to consider before launching a larger clinical trial.
The hope is that if this is an easy enough system to use and individuals enjoy the sessions, it would be cool to have this as an at-home option for individuals so they can continue with their rehab on their own time without having to travel into a hospital or a facility like that.
We complete our research at the Lyndhurst Centre, which is part of the Toronto Rehabilitation Institute. It is Canada's largest rehabilitation hospital dedicated to spinal cord injury. It's very important for the success of our research because there is that constant communication and interaction with not only people who are living with spinal cord injury, but also the frontline clinicians who are part of their rehab team. So collaboration was critical for this research. This is a collaboration between our lab and the lab of Dr. K. Musselman. So my lab is more focused on clinical rehabilitation, and we have bring clinical expertise to the project, whereas Dr. Musselman's lab is made up of engineers and brings technological expertise. They developed the system that we tested.
So being able to have somebody from Dr. Musselman's lab alongside me working on this project was really helpful in sort of troubleshooting and making sure that the equipment was working and that our setup went as smoothly as possible. And then again, also just having members of the clinical team, like a physical therapist who was doing our assessments with the participants.
So the next steps for this research is to first design a system that will be more easily translated into a clinical environment. So we've taken the feedback that we received from prior participants and we're trying to implement it and create a new system that is going to be easier for clinicians. Once that system is created, we are going to test that in a clinical trial. We'll be involving people with both spinal cord injury, but also stroke.